Hello, I'm Marina, tattoo artist and owner of Maximum Color. Today I would like to tell you about tattoo healing process. And permanent art on skin is as beautiful and desirable as it is initially a wound once ink is injected. And it will go through the same stages and mechanisms like any other skin trauma. There are 4 main stages that our tattoo will go through. And the duration of each stage may vary depending on tissue health, efficiency of our immune system, and management methods. The first stage is called hemostasis, and very often during the tattoo sessions I would hear a question, am I bleeding? And the answer would be yes. But how quick you will stop bleeding depends on how quick your blood cells will be able to create a blood clot, turning blood into gel. So this is the stage 1. The stage 2 is inflammation. And it's a natural reaction of our body to any kind of trauma. When we begin feeling pain, when we see that tattoo is swelling, the redness appears, and the tattoo becomes very sensitive to the touch, and you start hating me for touching a fresh tattoo and wiping it off with the tissue. So what happens inside at the moment, the blood vessels dilate to let white blood cells and nutrients and enzymes and other elements into the affected area to promote a healthy healing. Later at this stage, their thin scab will appear on the surface of the wound. So this stage might take from 1 to 3 days, and then the body will move on to the next stage, proliferation. At this stage, their wound begins to be built with a new tissue material. If this scab on the tattoo is very deep, it might crack and start oozing with a new building material, and I'm sure some of the ink lovers may relate to the situation. At this stage, the skin color around the tattoo may indicate if the process goes well. If the area around the tattoo appears to be a little bit pink or a little bit reddish, it means that the tissue is healthy, but the darker color may indicate the infection. And this stage might take up to a month for the body to move on to the next stage, which is maturation. Here, the dermal tissue is enhancing its new material. Even though the tattoo looks healed and the old cells being flaked off, the body is still repairing itself, and that's why the tattoo may seem a little bit dull or cloudy, sometimes shiny, and it will be very sensitive to the touch. The tissue in this area is still 20% weaker than it used to be before the tattoo. And they say that it may take up to 2 months for their tattoo area to be completely recovered or rebuilt. So it's very important to follow the aftercare instructions that are given to you by your tattoo artist. And if you notice any signs of infection, they can be inflamed, dark red areas around the tattoo or on the tattoo. If you have fever or any other signs, please contact your doctor immediately. And this covers the healing process. Now I would like you to demonstrate the bandage I'm using and explain why it promotes healing. So this is the bandage. It's called Tegaderm, and there are other similar products on the market, and it's very easy to use. Just peel off this paper, stick it on you, me in this case, just below the sides. So we all imagine a tattoo in the area under the bandage. So this is how it looks. Now, why it promotes healing. This bandage seals the natural elements and liquids that your body produces for healing, and thus promoting a faster healing. Also, this bandage lets the air and water through, maintaining a very healthy and normal level of breathability for the wound, but at the same time it protects from dust, friction, bacteria, creating a healthy environment for the healing. But sometimes even with this bandage on, we end up with scabs. If you have scabs, the most important thing would be let them dry. Expose them to the air, and wash your tattoo 2-3 times a day, and apply a very thin layer of ointment to your choice. It can be just unscented Aveeno or Lubriderm, or any other product specifically manufactured for healing tattoos. And one more thing to remember: if you end up with scabs, do not pick on scabs. If you do so, you may raise the risk of infection, scarring, and ink loss. So that's it for today. That is everything I came up with for this video. Next time I would like to cover some other topics. I hope this information is helpful for you to understand your healing process. And take care, get tattooed smartly. Bye.